All about Farydak, or Panobinostat.
Panobinostat is an oral therapy, so a pill therapy that is offered for patients, and it's approved in combination with bortezomib and dexamethasone. So panobinostat is an HDAC inhibitor, so which is a unique mechanism in action to be able to offer to patients.
What is an HDAC, or histone deacetylase inhibitor?
An HDAC inhibitor works specifically on histones or uses epigenetic changes to be able to modify cancer cells. Importantly, this is a novel class of therapies that's offered for patients.
What is the indication of Farydak?
Panobinostat is offered in combination with dexamethasone, in combination with bortezomib. Panobinostat is approved after patients have received either a proteasome inhibitor or an IMID class of drugs. So this combination of panobinostat, which is a pill, in combination with bortezomib, which is a subcutaneous shot that's injected, is also given with steroids.
The NCCN guidelines for myeloma therapy say that Farydak can be used in combination with Revlimid and dexamethasone, or in combination with Kyprolis in certain circumstances. What is the schedule and dosing of panobinostat?
Panobinostat is given on days 1 and 3, in addition to dexamethasone and bortezomib that is given on days typical bortezomib schedule on 1, 4, 8, and 11.
According to the manufacturer's prescribing instructions, Farydak is given on days 1, 3, 5, 8, 10, and 12 of a 21-day cycle. The recommended dose is 20 milligrams.
These are typically 21-day cycles that can be adjusted for patients based upon tolerance, in addition to other side effects that can be managed, such as hematologic toxicities, checking at things on blood counts to make sure that the patient is able to tolerate it.
Avoid eating starfruit, pomegranate juice, and grapefruit or grapefruit juice while taking Farydak. These foods may affect the amount of Farydak in your blood. What are common side effects of Farydak?
There can be changes with hematologic toxicities, and what that means is it can have changes to your blood counts, which include a low white blood cell count, anemia, and a low platelet count. This can put patients at risk for having infections. They sometimes may require growth factors or Neupogen to be able to stimulate white blood cell count recovery, and or blood transfusions or platelet transfusions. Importantly, when we talk about panobinostat, it also can have other non-hematologic toxicities that can be significant. Some of the non-hematologic toxicities include diarrhea and nausea and vomiting. These side effects can be significant, as well as it can contribute to significant electrolyte disturbances. When someone is having a significant amount of either nausea, they're not eating very well, and also having diarrhea, you can lose a lot of critical electrolytes, which also can contribute to having heart arrhythmias or heart changes that can be significant.
Additional side effects of Farydak included decreased appetite, fatigue, increased creatinine levels, and infections. Contact your doctor immediately if you have a fever, night sweats or chills, a cough, body aches, shortness of breath, blood in your phlegm, or a warm or painful area in your body. Liver toxicities have occurred in patients treated with Farydak. Your doctor will monitor your liver with appropriate blood tests. Contact your doctor right away if you have a dark, amber-colored urine, yellowing of your skin or the whites of your eyes, or if you have upper stomach pain. How are these side effects managed?
Because of these toxicities, oftentimes patients who experience significant nausea, vomiting, or diarrhea will also, at the time of prescribing this therapy, prescribe anti-diarrhea medications, or even schedule patients to receive fluids and anti-nausea medications as part of the care for this therapy. But it is an important therapy because it offers a different mechanism of action from prior therapies that most patients would have received.
Additionally, suggestions for managing fatigue and other side effects discussed in this video can be found in the Patient Solutions tool of HealthTree Cure Hub. Search on a specific side effect to find solutions that others have found helpful. These solutions have been provided by patients just like you. You can also filter side effects by an individual drug or combination of drugs. When filtering on a combination of drugs, keep in mind it might not always be clear which drug is creating which side effect.
It's an important aspect when we're talking about treatment options to make sure that quality of life is addressed for patients as well. And that's a particularly important aspect of their care at Ohio State. taking care of older adults specifically with multiple myeloma is that we want these therapies to be effective and for these therapies to work in controlling their cancer, but we always have to be cognizant to make sure that we're balancing the toxicities of the therapy with the benefits of the therapy. And that's particularly important in a patient population that I take care of and relevant to aging adults with multiple myeloma. When we talk about many of these different side effects and the many therapeutic options that are available, we have to think about the patient in terms of what their pre-existing medical factors are. They've also previously often had prior myeloma therapy, and so we need to make sure that they haven't experienced side effects from those therapies, so we're able to design a treatment plan that is unique for the patient.
What is the REMS, or Risk Evaluation and Mitigation Strategy program?
Panobinostat is required for patients to participate in the REMS program. The REMS stands for the Risk Evaluation and Mitigation Strategy. This is a program that is required by the FDA to make sure that both the patient and provider are aware of the significant toxicities that can be associated with this drug in particular. And so patients are required to acknowledge and fill out a survey through the REMS system as well as the physician who's prescribing this drug.
The Secure Care Patient Support Program offers help with insurance verification and patient support programs. To access Secure Care, please call 844-9-SECURA, Monday through Friday from 10 a.m. to 7 p.m. Eastern Time. The patient support program includes the copay program, which offers quick and easy access to copay assistance for Farydak. With the copay program, eligible commercially insured patients pay no more than $5 per month, up to an annual maximum of $25,000 per calendar year. Find out eligibility for the copay program by calling Secure Care. The Patient Assistance Program is available to support low-income and uninsured patients. Please contact Secure Care to understand if you qualify.